1992, a film entitled The Medicine Man, starring Sean Connery, was based on the life of Richard Evans Schutis, 1915 to 2001. He was an American doctor who traveled to the Amazon in search of medicinal plant cures used by the Amazon Indians. How true this story is remains to be seen, but in truth, this is how medicine began. The early hunter-gatherers would see a plant and test it for its value, either medicinal or nutritional. It was women's work until it became interesting to the men, who became the medicine men or witch doctors. The earliest recorded medical papers are attributed to Imhotep of Egypt, who recorded over 200 diseases and cures approximately 2,600 years BCE. That's just almost 5,000 years ago. Get off the tangent. Hippocrates had an exceptionally long life. He lived 90 years in the approximately 300 years BCE. His body of work included 72 books and 59 treatises, which suggest a collaborative effort. He was one of the first to advise those who might want to become a physic doctor, go to war as an anatomic study. He believed, as most did at that time, in the four humors, as they do suggest the appearances of patients: wet, sweating, hot, feverish, cold, chilled, dry, normal. He believed that the accurate prognostication by a physic was most important in his reputation. He believed that patients wanted sympathy, kindness, and relief. His core belief, and you'll hear this throughout, is primum non nocere. First, do no harm. He set the standard for physician conduct and for patient relationships. Aristotle lived about the same time, 300 years BCE, but he only lived 50 years. He was the son of a physician, a physic. He was a student of Plato, and we could call him the father of comparative anatomy. He was a tutor of Alexander the Great, who returned the favor by subsidizing his work. He was the first to describe a fetal heart and the great vessels. He was the first to state that a woman has only one uterus, not one for males and one for females. He said that the fetus does not breathe intrauterine. His influence, along with Hippocrates and Galen, who we'll speak of shortly, were probably the most influential medical authorities in pagan, Christian, Hebrew, and Muslim medical thinking. Celsus lived only 50 years, but it was 50 years in the 50 years in the Common Era. He was an exceptionally fine librarian who categorized all medical knowledge in his time. Unfortunately, his work was lost for almost 1,500 years. Think Dark Ages. When found, Pope Nicholas had it printed on movable type, one of the first to be done. Galen lived about 70 years late in the same first century. Galen may be the most controversial person in medical history. He was a brilliant braggart. He read voraciously and collected the work of all those who came before him and commented on it. He didn't do the first lick of experimental work or dissection work. He merely pontificated and he got away with it. He charmed the wealthy elite. He had been said that I treat them in the morning and they take me to dinner in the evening. We think he may have seen two skeletons, but we're not certain about that. He ascribed the external anatomy of the apes onto humans and the internal anatomy of pigs onto humans. An influential author, professor, and curator of the Library of Congress, Daniel Bernstein, also a favorite of mine, called him a tyrant who had influential sway for 1,500 years. There are rumors that his formulary still exists. I could find no trace of it. It's been called treacle, theriac, or mithridatum. It was opium and charcoal. That's a really fine mixture to start with. However, people were frightened of poisons, so they kept adding to it, and every time they added to it, they decreased the amount of opium and charcoal, making it effectively almost useless, or perhaps our first homeopathic concoction. It was effective for coughs and stomach aches, diarrhea, and maybe some aches and pains. He has been the most prolific medical writer of all time. He wrote in Greek, and his work was in the Library of Alexandria. The question is, how could he be the primary medical thinker for over 1,500 years? Well, the first 1,000 years were the Dark Ages. Secondly, he professed, first, nature has a purpose. That is pure or Aristotelian thinking. But it endeared him to the church, who then protected him. Secondly, I know the purpose, which didn't endear him to anyone. People did try to bring him down, but they all failed. Now, these three thinkers and their contemporaries are the first process thinkers, which means if this, then that. The last of the early thinkers I want to talk about is Andreas Vasalis. He lived for about 50 years in the mid-1500s. Think Renaissance. He was an Italian from Padua. He studied in France with the best teachers best teachers in schools. When war broke out between France and Rome, as usually happened, he returned to Padua, sat for his exams, and they immediately asked him to take the chair of anatomy and medicine. He did. In anatomy, the anatomy chair would sit in a throne and look down on the barber surgeons who were working at the dissection tables. The students sat in an elevated form. He got down from his chair, dismissed the barber surgeons, and did it himself. It was easier and more effective. He created 6 detailed anatomic charts of the organ systems and had them indexed in Greek, Latin, Hebrew, and Arabic. They were published. They were circulated. One would think that after such a meaningful description of anatomy, one would be pleased to forswear Galen, but not so. Galen's supporters, Galen must be read. I can't understand that if you're looking at anatomy. Well, with some help from a man who took the name Paracelsus as an homage to Celsus, Vesalius won the argument and Galen was deposed. Paracelsus' real name is Augustus Philippus Theophrastus Bombastus von Hohenheim. With a name like that, he's just got it mentioned. Early on, there was a separation between healthcare professionals. Those who would be upper class and did no work with their hands would be called doctor. Today we might call them internists. Those who worked with their hands would be called mister. Today we might call them surgeons. Those who sold product would be called apothecaries or pharmacists. A few years ago, maybe about 10, an author named Cahill decided to write, he wanted to do 7, but I know he wrote 2 small booklets on how small groups of people affected history. His first one was How the Irish Saved Civilization. It was mildly interesting. The second one was not, and I found no evidence of a third. His premise was this, that as the Dark Ages occurred, knowledge was stored in Irish monasteries as documents. The monks would carry them, copy them, until they had a complete set. Then a senior monk would leave with a cadre of monks and copies of the documents to repeat the scene in a new abbey, and they would establish the same copying system. He now completely overlooked the library at Alexandria. When flight of knowledge to the east occurred during the Dark Ages, information and knowledge moved east with the Arabics. The 19th century in America is consistent with the Middle Ages in Europe, in that in the beginning and the end, things were totally different. At that time in America, there were few medical schools. Physician training was almost purely apprenticed. There was little or no academics, just on-the-job training. In 1860, Oliver Wendell Holmes Sr. declared, "If the whole of materia medica as now used could be sunk to the bottom of the sea, it would be to the betterment of mankind and worse for the fishes." He was severely criticized for this. He also had an earlier nascent opinion regarding puerperal sepsis, childbed fever, but he didn't follow through with it. Thankfully, in 1847 in Vienna, Ignaz Semmelweis did. Now, the story goes in seven different directions. Fact is, he was in a middle-level obstetrical practice, and he saw the women dying of childbed fever. I'd like to say he saw the blood on his contemporary's hands and said, "It's the blood that's carrying this. Wash your hands." It didn't happen that way. He had a colleague who died from a puncture wound, just a needle stick. And while he was investigating his friend's death, he realized his symptoms were the same as childbed fever. He took the position of washing your hands with chlorine. He made his people wash their hands with chlorine. The death rate dropped precipitously. He reported that to his supervisor in the clinic, who merely said, "Yeah, we thought that was going to happen. We put in a new ventilation system. If I'm lying, I'm dying." During our Civil War and even into the First World War, troop conditions caused frequent outbreaks of communicable diseases. Sadly, in the Civil War and even into the First World War, wounded could not be removed from the battlefield in a timely fashion. I could not find any meaningful armistices that would have allowed that, yet they make movies of the two sides saving a horse. Such things as ambulances and meaningful field hospitals became more frequent as the conflict dragged on, but it took 2 years to get to a reasonable state of part. By Gettysburg, the treatment facilities had improved. However, in 1863, the Surgeon General William S. Hammond of the Union forces ordered the removal of calomel and tartar emetic from the Union supply table. These drugs induced vomiting and diarrhea. The doctors revolted. Hammond was court-martialed and ostracized, and emetics were replaced to the table. Two things to keep in mind during the Western expansion. More than that, one of the most notable medical personnel was a tubercular dentist named Doc Holliday. During that period, a common grave marker read, "Married at 17, mother at 18, died at 19, most likely childbed fever." Medical education at that time was purely apprenticeship. As I've said, there were few very poor medical schools, but a young man seeking a medical career could apprentice himself to a physician for about 2 years. That would be enough time for the trainee to see and learn almost everything his trainer could show him. There was really little impetus toward improving the craft. They probably did not know how to do it even if they considered it. Things were not good. And when things are not good, thinking people seek changes. One of them was the founder of the osteopathic profession. His name is Andrew Taylor Still. He lived from 1828 to 1917. He was a physician who studied with his father, who had been a physician, and was also a Methodist minister. Andrew read all the texts that were available, and he had I want to say, going medical practice. He really wasn't as successful as he would have liked in his early years. He had severe doubts about how medicine was practiced, and it was long before the Civil War. He did serve in the Civil War. He had a right to those feelings. He had a wife and between 10 and 12 children. Nobody seems to agree. He lost most of them to what they called spinal meningitis. I tend to disagree with that. I think it was probably malaria. A litany of the common medical diseases at that time would include typhoid fever, typhus, pneumonia, scarlet fever, dysentery, meningitis, and smallpox. Now, Jenner's smallpox vaccine was available, but people did not trust it. Malaria was a primary cause of death. Quinine was known, but it was expensive and rare. Dr. Still was not the first to challenge conventional medicine. He was not alone in his thinking that heroic medicine is not helpful. Heroic medicine is, my definition, is if you survive what the doctors are doing to you, you're a hero. It was based on purging, by vomiting, by diarrhea, and by bleeding. This sets a stage for less than optimum people to get involved. That, and also the fact that the movement west, there was just not enough real legislation and control of things to keep things on an even par. One of the worst was a man named Samuel Thompson. He was a self-educated healer who relied on botanicals to produce sweating and vomiting. He was a significant persona on the medical scene. He attacked the regulars, claiming that they prolonged illness, that formal education was not needed, and that licensing was a manner of protecting themselves from monopolizing the healing arts. He was vicious and he was wrong. Another man who is really more helpful, though it doesn't get the credit he deserves, is Samuel Hahnemann. He brought his homeopathy from Germany in the early 1800s. The belief was like cures like. Little doses of whatever the patient was suffering from, administered to the patient, would cause healing. He took the name homeopath for his people, and he called the conventional or regular doctors allopaths for all others. He did very well. His patients were sick enough from disease that they needed no additional insults. There was more than a few other modalities of this type. There was hydrotherapy, magnetotherapy, and to paraphrase Aristotle, in the kingdom of the blind, the one-eyed man is king. Now, I talked just a bit about medical education. I'm going to talk again. I told you that Andrew Taylor Still was a Methodist. His father was a Methodist. Methodists do not use alcohol. In his thinking, alcohol, medicine, medicine, alcohol, I don't think so. I'm not sure. I just don't know. He continued his conventional medical practice for about 10 years before he made a change, but he was truly torn. The bone setters were a group of people who could manipulate joints, just move them around in their normal fashion, and they were available to people who had deformities or had arthritis. They weren't regular doctors. They charged less, so people would go to them. Still found them. And he noticed while they were manipulating the hands, the shoulders, the arms, that the gray skin was beginning to pink up. That means blood. And he saw that and he liked it. They spoke in flowery terms at that time. He called that the rule of the artery supreme. I can't tell you what happens in an osteopathic medical school today because I don't teach there anymore. But in my time, you heard the rule of the artery supreme. Part of the bone setters was reducing dislocations, and Still got good at that. Perhaps when a dislocation is reduced, the blood supply and light comes back to normal, and he would see the instantaneous relief of pain and thought that perhaps minor strains or sprains could be treated as similar but less intense manipulation. having a more general focus than the obvious overt dislocation. He saw the use in chronic joint disease by improving motion, improving symptoms. He may have been thinking as Hippocrates, first, do no harm. More likely, he was thinking he could improve his practice and afford his patients some relief by correcting mini dislocations or perceived misalignments. And further, the laying on of hands has always had therapeutic value. Dr. Still created the basic tenets of osteopathy, wherein the body could heal itself if the bones, ligaments, and muscles were properly aligned. He termed it osteopathic manipulation. Osteo for bone, path for pathology, disease. Patients were sick enough from their diseases that they needed no additional insults from the heroic physics. It was a nice idea of propagating healthy habits that lead to healthy lives. He established his clinic in Kirksville, Missouri, in the northeast corner of the state. That's the site of the first college of osteopathic medicine, and it remains there to this day. Not very long after, B.J. Palmer, a farmer and lay healer in southeast Iowa, may have seen what Still was doing and may have had an I can do that moment. Palmer had an interesting patient who was apparently deaf and apparently regained her hearing when Palmer pressed on her spine. Now, there's no correlation between auditory problems and thoracic or cervical vertebral problems. Shortly thereafter, he founded the Palmer Chiropractic College. I cannot tell you the what, why the sequence of events occurred. I can tell you that the coincidences are interesting. Southeast Iowa is proximate to northeast Missouri. A.T. Still was manipulating his patients. He was a licensed physician. B.J. Palmer was an intelligent lay healer and a farmer. Do not denigrate farmers. They learn how to solve problems. Still was manipulating his patients while other doctors with MD degrees were bleeding and purging theirs. Still was following Hippocrates, first do no harm. Some of those circuit riding doctors may have been altruistic. They may have thought there's a way to provide better patient care. They had no opportunity to do that, but there was opportunity for financial gain. All they had to do was apply to the state for a license for a medical school, rent a classroom, charge the students the same for the discussions that they would have had if they were preceptors. This was not good. The system had to be fixed. Even if they wanted to fix it, they had no knowledge as to how to do it. But in 1847, the American Medical Association was formed. We started in the 1800s. We're now only 50 years shy of the end of it. Now we're talking a medical association. Just as the guilds in Europe, they wanted to establish standards of care. The impetus going forward was improvement and standardization of the craft, its education, and supplementing the preceptor programs. Improving the standards meant increasing the study program from a few weeks to months to years. It meant admissions requirements such as earning a bachelor's degree. It meant meaningful examinations. In 1871, Harvard added a 9-month academic year to with examinations. Their enrollment dropped 40% and it stayed there for years. Many of the for-profit schools closed if the students could not or would not pay the fees or dedicate the time. At that time, a group of physicians in Maryland founded the College of Medicine at the University of Medicine. One of the truly altruistic schools was the Lynn School of Chicago. It went through many iterations, and today it's called the College of Medicine. I love it. At Northwestern University. One of the best colleges of medicine in the country. Others followed suit, and by the 1890s, several schools with university affiliation included the University of Pennsylvania, the University of Michigan, again a top-notch school, and the University of Syracuse. I don't know how Syracuse got in there. The Johns Hopkins School of Medicine was founded in 1893 thanks to an infusion of money from John D. Rockefeller, whose personal physician was a naturopath. The Hopkins flourished early thanks to three doctors whose names were William Welch, who said, "We've got to have a university in front of this medical school. We have to teach students how to learn and to make them want to learn." William Osler was a beloved teacher who stimulated and inspired his students. William Halsted was one of the best surgeons in that time. He was the first to use gloves in the operating room. It wasn't quite his idea. His scrub nurse, his first assistant, was his fiancée, who would be his wife. She was not putting her hands into an open cavity in a human body in her bare hands. She wore gloves. And a medical student looked at that and said, if we wash these gloves and re-sterilize them, we can use them again. Hopkins set real standards, an undergraduate degree, and a four-year curriculum with meaningful examinations. The AMA Committee on Education, with assistance from the Carnegie Foundation, hired Abraham Flexner, another luminary, his brother was the same, to evaluate the medical schools using a three-tiered ABC grade system. I don't know what his criteria was, but I do know that only 3 schools in the country passed his test: Harvard, Hopkins, and the University of Michigan, medical school at the University of Michigan. That started what we have today, a rigid, recurring evaluation of all medical schools and all medical programs that are functioning with independent examiners. In modern times, these two philosophies, osteopathy and conventional medicine, or allopathy, I can't tell you, have moved together. Each were embracing conventional medicine. You know from the first year of physics that objects at rest tend to stay at rest. Those in motion tend to stay in motion. Something had to happen to accelerate this transition. There are several principal factors. The first was the ability to synthesize drugs rather than extract them from plants. Penicillin was discovered in 1925, but it was not synthesized. It had to be grown. When the Allied forces invaded France at Normandy, they carried penicillin. In 1959, I was at Ohio State University. My bacteriology told me the story, told the class this story. He had been the medical service director for the Mediterranean theater during the Second War. As such, he had 12 vials of penicillin to be used only in an emergency. At the end of hostilities, he had 12 vials of penicillin. How do you determine an emergency? The second major factor that brought us together were the drug manufacturers. They wanted to sell their product, and DOs were using their products, with the exception of Lilly Pharmaceuticals. I can't tell you why Eli Lilly forbade his salespeople from calling on DOs. He hated them, and I don't know why. I can tell you this: when Eli died, his company, Lilly Pharmaceuticals, turned on a dime, and they spent a lot of money catering to osteopathic physicians. They had a lot of ground to make up, and they knew it. By the time I finished medical school, that was 1965, there were many good drugs being synthesized and more coming. We never said we would not use drugs. We said that we would not use drugs that don't work. The third phenomenon bringing us together was Vietnam. We never should have been in it, but we were. The government needed doctors. Osteopaths were doctors. The AMA objected, but only mildly. The government needed doctors, and they accepted anyone they could get. Some of my classmates are on the wall in Washington. I am sure I'm not alone. I'm sure I'm not alone in making that statement. And then he came home damaged. Some of our doctors were stationed in California. They wanted or needed to practice part-time for economic reasons. California had no DOs. They had no licensure. Then they had DOs. They had to have licensure, and they did. Now, I've been in this craft for over 50 years. I have known and worked with a lot of doctors in my career. Some were great. Some were not so great. Some were not so great by a very long shot. But they knew their limitations and stayed within them. The degree was never a measure of individuals' ability. It was a statement of completion of a course of study. Lastly, is the desire to be paid, hence insurance. Insurance is a lecture in itself, but it was important in drawing the two groups together. Medical insurance was first formulated during the Great Depression, initially to pay physicians for workplace injuries and diseases. Both conventional and managed care were created at the same time. I think Blue Cross may have been started initially by a physician until professional management was needed. World War II and the federal tax code and the labor movement entered the mix. Medicare was introduced in 1965 for elder care. Its creation and subsequent Affordable Care Act were two very important factors in moving the two groups together. Southern conservatives were vehemently opposed to both. They sent emissaries from the South across the country trying to convince doctors to resist the programs. They had representatives from any and all ethnic groups one could imagine. Fat guys, skinny guys, tall guys, short guys, guys with long hair, guys with no hair. They failed to do this, but they had to admit that the education and standard of care for both MDs and DOs were equal. The government insurance company also said so. Commercial insurers compete with each other to garner contracts with large employee groups. It's really a matter of spreading the risk. These created significant changes in the financial aspect of both MD and DO groups. The federal government actually and almost inadvertently pushed the two groups together. The enemy of my enemy is my friend. The insurance companies created diagnostic-related groups with a fixed reimbursement for each group. Example, a broken bone is not just a broken bone. It could be comminuted into multiple parts. It could involve a nerve, it could involve an artery, it could pierce the skin or not. Diagnostic-related groups had to be broken down into subgroups, and there was a fixed reimbursement for each group to better control the hospital costs and the reimbursements for service rendered. MD and DO hospitals were treated alike. This forced the hospitals to become more efficient with inpatient care. Those who could admit, treat, and discharge a patient more effectively and efficiently would get benefit from the pay. Those who could not would suffer. The MD and DO hospitals were treated identically in each region. They were in the same boat. The diagnostic-related group was the same in every region, with one exception. Osteopathic manipulation was codable. It was the same in any region. Now, region in Florida would be a county, and the region county next to it would have the same diagnostic-related groups and the same pay schedule, but the state of Nevada could be a region into itself. We knew in advance what the hospital reimbursement would be, and we had to get it done for the dollars that we would be paid. The biggest question were outliers. How do you describe the bone fracture? In my craft, I would merely describe a lumbar spine examination by saying a lumbar spine exam was done and this is what we found. What I had to do was say a lumbar spine examination to include an AP frontal film, a lateral film, 2 oblique films, and a spot film of L5. If I didn't do that, they wouldn't pay me. I had to say that. Fortunately, I had a good secretary. Betsy, this is the new dictation for a lumbar spine. I say lumbar spine, this is what you're typing. We knew in advance what we were going to get paid, and if we got it done for less than that, it was good for us. The question was the outliers, and I told you something about that. In every county, we had to teach people how to rethink. Doctors don't like to change habits. There was a new system of reimbursement. We had to convince them that it was now the new rules. We established the American College of Quality Assurance and Utilization Review. This was not easy. It was a lot like herding cats. I was the president of the Southeastern chapter. We had seminars and lectures to teach doctors. We had a certification program where they could take a course of study, take an examination, and get another certificate to hang on their wall. My brother's a surgeon in Colorado. Going off round, that's okay. He's a surgeon in Colorado. Jay, you ought to take this course. You ought to go through the course, take the examination, get certified in this. He did. He got a certificate. My name was on the certificate. He never found it. Medicine today is a business. I'm glad that I no longer practice. That doctors today are making more money than I ever thought we would make, but I'm not jealous. I was president of the Dade County Osteopathic Medical Association, 1977-78, and the Florida Osteopathic Medical Association, 1986-87. Early on, when I came to this state in 1972, I was told that if the medical associations away from Florida needed something bad to say about DOs, just call Florida, they'll give you something bad. On the 2nd of August this year, an internist, osteopathic internist named Joshua Lenchus, who was president of the FOMA 2018 and 19, will be installed as the president of Florida Medical Association. The cycle is complete. Thank you very much.
Thank you, Terry.